We all know intimacy is a beautiful thing. It's a fundamental part of the human experience. But what if this pleasurable act came with a catch? For some men, that's their reality. They experience debilitating symptoms after orgasm. This is post-orgasmic illness syndrome, or POIS, a condition that turns joy into suffering. Imagine flu-like symptoms right after climax: fatigue, muscle aches, feverishness, and mental fog, turning passion into pain. This is the harsh reality for men with POIS. Their bodies react to orgasm as if it's a threat, triggering an immune response that leaves them feeling awful. The symptoms can vary in intensity and duration. Some men experience mild discomfort that fades within a few hours. Others suffer from severe symptoms that linger for days, disrupting their work, relationships, and overall quality of life. This roller coaster of post-orgasmic distress often leads to anxiety, depression, and relationship issues, adding another layer of complexity to their lives. POIS is a complex and often misunderstood condition. It's crucial to remember that these men aren't exaggerating their symptoms or making them up. They're battling a real medical condition that deserves recognition, understanding, and effective treatment. The million-dollar question, you might ask, is how common is POIS? Well, it's considered a rare condition. But here's the catch. It might be more common than we think. The lack of awareness among both the public and healthcare providers often leads to underdiagnosis and misdiagnosis. Many men suffer in silence, unaware that their post-orgasmic woes have a name and potential solutions. Think about it. Men might be hesitant to discuss such an intimate issue with their doctors. Embarrassment, shame, and the fear of not being taken seriously can be significant roadblocks to seeking help. Furthermore, the symptoms of POIS often mimic other conditions, making it tricky to pinpoint the actual culprit. The exact prevalence of POIS remains a mystery. Research on this condition is still in its infancy, and we need more extensive studies to understand its true scope. Some experts estimate that up to 10% of men might experience some degree of post-orgasmic discomfort. However, these figures are based on limited data and self-reported symptoms, making it difficult to draw definitive conclusions. So, how do we diagnose this elusive condition? Well, there's no single test to confirm or rule out POIS. It's a diagnosis of exclusion, meaning doctors need to rule out other potential causes of the symptoms first. This can be a frustrating and time-consuming process for both the patient and the physician. The journey often begins with a detailed medical history, including any allergies, medications, and pre-existing conditions. A physical exam is also crucial to assess overall health and rule out any obvious physical abnormalities. Blood tests and allergy testing might be ordered to eliminate infections, hormonal imbalances, or allergic reactions as potential culprits. In some cases, a semen analysis might be recommended. The theory is that men with POIS might have an autoimmune reaction to their own semen. This means their immune system mistakenly attacks components of their semen, triggering the cascade of symptoms. While this theory holds promise, more research is needed to confirm its validity and develop reliable diagnostic tools. Section 4. Exploring the roots, potential causes, and contributing factors. While the exact cause of POIS remains a puzzle, researchers are exploring various avenues. One theory is an autoimmune response to semen. The body perceives semen as foreign, triggering an immune attack. Hormonal imbalances might also play a role. Sudden hormone changes during orgasm could trigger symptoms. Psychological factors like anxiety and stress might contribute. Infections, particularly of the prostate, might increase risk. Allergies to semen components could be a factor. Genetic predisposition might also play a role. Section 5. Hope on the horizon. Raising awareness and seeking treatment. Living with POIS can be incredibly isolating and challenging. Men often suffer in silence, afraid to seek help or discuss their condition with their loved ones. It's crucial to break down the stigma surrounding POIS and encourage open conversations about sexual health. By raising awareness, we can empower men to come forward, seek help, and reclaim their quality of life. While there's no one-size-fits-all cure for POIS, various treatment options are available to manage the symptoms and improve quality of life. These options range from lifestyle modifications to medications and therapy. It's essential to work closely with a healthcare provider to determine the best course of treatment based on individual needs and medical history. Remember, knowledge is power. The more we understand about POIS, the better equipped we are to diagnose, treat, and support those who are affected by this condition. If you or someone you know experiences symptoms of POIS, please reach out to a healthcare professional. You're not alone, and there's hope for a brighter, healthier future.